Yes.
It's a paracentesis. It's a procedure where we remove fluid, acidic fluid. The fluid is in between your bowel and the abdominal wall, just sitting around, floating around. And that usually happens because you don't have enough protein in your bloodstream to keep the fluid inside, so it starts to leak. And it's leaking over 2 weeks where this belly's been growing over time.
Right.
And that's how you ended up like this today. Okay, so,
you're welcome.
The other reason we're doing, not only is it going to make you more comfortable, because it's going to remove enough fluid that you're going to feel better, but we're also going to clean the fluid to make sure you don't have an infection. And we can test it also for cytology. Cytology means we send it for analysis, make sure it's not like cancer or something like that. We honestly don't have any reason to think it's cancer. We did a CAT scan, there's no masses, there's no pus or anything like that.
That works for me.
But the one reason we think it might be SBP, spontaneous bacterial peritonitis, is because your white blood cell count are being high.
Right.
Normal's about 10 to 10.5, and yours. Yeah. Okay. So we did an ultrasound. We found that this spot right here is where we're gonna go. Bring this arm around your back, like you're chilling out like this.
Yeah.
Oh.
You can still move your arm up.
Just like this?
Yeah, so it's out of my way.
I'll hold my little bar up here.
I was going to hold your hand, but I've been advanced.
Just not squeeze that bar. They'll drop their head.
Oh, really?
Yeah.
Oh. Well.
There's another one. You can hold that one. That one's safe.
Just don't touch this blue stuff.
Okay.
Off limits. Little pinch. And then you just go in through that same spot. And we pull back a little bit. And at some point we're going to start getting the fluid already. And that's how we know we're inside.
Vacuum.
Oh, not yet. There it is. Starts getting yellowish. I don't know if you can see the yellowish on the syringe, but you know you're in. I just removed that, starts leaking out. But we don't really care about that yet.
Oh, Doc, they're getting bigger.
Yeah, I know.
Yeah, but that one's already numb. You always want to pull the skin back just a little bit so that the track is not perfectly straight. It's a little angled. So almost like when you do IVs and you pull the skin on them. It's the same spot. And in just until you get the fluid. Actually, we should have been getting fluid already. Can you pick that phone and just say that?
Oh.
So.
Is it coming for you?
He's doing a procedure right now. Ring, ring. Okay, sounds good. It was CT. She'll call you back.
So this is to draw the fluid. Now we need one of those urine specimen cups so that
Okay.
we can put the fluid that we drain out.
Of course, I think they're right there, so I'll grab that.
There we go.
Wow.
beautiful stuff going on.
And it is. It looks just like urine because it's a transudate, with proteins and stuff like that. And it's nice and clear. So if we thought it was infected, it would look cloudy, it would look brownish, thickened. It wouldn't be as clear. All right, so that's really all what we need for the diagnosis. So we don't need to do anymore, but we still want to get as much as possible for your comfort.
Thank
so
you.
we're gonna hook it up to this.
Wow, that's insane.
Yeah, to think that that's just sitting there.
Floating
Oh, I've
around.
noticed the discomfort.
I'm gonna become unsterile too. Oh, that goes straight. So I was right. No needing any.
You want the urine one? I had this one too.
Specimen cup is fine. It has to be sterile. It's sterile?
Yes, it's
Yeah.
sterile.
And
Mhm.
Does that look better? That looked better than that junk I left on the counter for you earlier.
That's true.
there we go.
So that's just like a lure lock that locks in.
So just
the
like an IV,
catheter?
just like an IV, you float it in, and then it's just soft, so that the
Okay.
bowel, once the fluid starts coming out, the bowel starts getting closer to that catheter. So if it was made of metal, it would still nick the bowel, and then you would have perforated bowel and poop coming out of it.
we don't want
So this
soft.
is soft, so it allows it to be moved
Mhm.
around. So
Okay.
one thing you can do, this patient is kind of like push around to kind of force the fluid into that
Mhm.
space. So sometimes the pocket's not as good as we thought. No,
Oh, there it goes.
Sometimes the bowel itself gets stuck with the little
Mhm.
holes and it stops draining. Now the important thing is I'm no longer sterile, so we can always reposition, but you don't want to touch the white part there. And it might be so positional that it might not get as much as I would have liked. It's very positional. It might be getting kinked or something inside. I wonder if manual epic is manual. Yeah, if you want to kind of slowly lean towards me, that will be fine.
Oh.
Yeah, just like that, just kind of like a degree angle here. Basically, you're kind of forcing the fluid to that area there.
Oh.
Found a little bit of fluid.
That is crazy.
The most I've taken out is 9 liters.
Okay.
9 of those.
Oh my god.
That's crazy. I've seen 4
It's
and
bottle
never
after bottle after bottle. Now when you remove that much, the danger is then you can get what's called rebound hypotension, because the body says, hey, where did all this fluid go? Let's put some more in there. And then you get hypotensive, your blood pressure drops. So if you drain that much out, I see what you're doing, that's good, that's good. If you drain that much out, then you usually start albumin transfusion. You use protein
Oh, that's
through the
fine.
IV to keep it inside.
I am. He's in room 12. Okay.
So this is good what
trauma
he's doing
one.
with
Trauma
pushing.
1, the propofol's not keeping him sedated. In trauma 1. So go ahead and bump it up a little bit.
If not, they can get
It's already bumped
Garrett
up
to
to 40.
put something else in for sedation, I guess. I can't do it right now,
He's
so
at 25 right
tell
now.
the other guy.
Okay, he'll be out in just a minute, so Do you want a bolus of anything?
You can give him to a Versed.
To a Versed.
Oh, well. We're starting to blow up.
Was this uncomfortable, the procedure?
No, not at all. You know the initial, I guess you just used the
Numbing?
numbing. I mean, it has a slight burn to it, but I mean, it's brief, and then everything else is kind of. You feel the pressure, but I mean, it's not painful. It's just, you know, something's inside of you.
Yeah.
Are you starting to feel any relief at all, though? Like, can you tell a difference?
Oh no, I'm just happy to watch it be going. I think I'm more in awe of the whole process. Holy moly.
Pretty cool. I like doing things like this because they're immediate. They give you relief. We know what's going on.
I mean, I can definitely, I'm starting to be able to differentiate my muscles and my skin just being expanded.
She's probably gonna get another one. I mean, as long as it keeps flowing, I'll keep going.
Okay.
You know?
Wow.
That's crazy.
Yeah, I really thought that he was joking when he said you were going to do this.
Really?
Yeah.
What part? You thought you
Just sticking it in and releasing it out, I was like, there's no way this is possible. But it is actually a real thing. So how does all of that form in there without, like, unlike, say, me who where it is not in there? How does that happen?
You said like lack of protein, right?
Yeah. So, how do I explain this? Like chemistry, going back to chemistry and stuff. You go swim on the ocean, you get really wrinkle in your fingers.
Mm-hmm.
That's because the ocean has a lot of salt on it, and your body tries to dilute the ocean. Stupid enough, right?
Mm-hmm.
So you start getting dehydrated and bringing water out. So the body has ways to move fluid across a membrane. So what happens is his proteins in his blood are very low because of his liver issue, right?
Mm-hmm.
And because of that, that blood is very thin. And then in trying to balance this, it starts accumulating fluid into his, and he can't keep the fluid trapped in the vascular space. It's just going to his belly.
Right.
That's why this is only a temporary measure, because his body's going to make it
It's
again.
going to do it again, yeah.
I don't know. I can't see through that hose.
It's still, like when you squeeze it, yeah, it's still filling up.
Time to spill it on my head.
Yeah, so for a moment I thought, oh man, we're not gonna get that much. But then sure enough, you moved just the right way,
Yeah.
so you probably took that piece of bowel out of the way, so now it could start flowing again and just flowing very well.
Yeah, that one went quick.
I'm gonna take it really fast.
Yeah.
I think I wasn't gone that
Barely
long.
made it back.
So some patients with this problem might be scheduled every 2 to 3 weeks to get one of these done. You come outpatient, you get it done, you feel better. But obviously that's no way to live, you know. But until hopefully we can jumpstart your liver, it starts repairing, start making proteins by nutrition and diet and things like that, so that you don't have to have this done. Or
Even when a lot of this first started up, you know, I knew that because of stress from family and stuff, that the protein was a huge
factor.
Yeah. And I was trying to eat a lot of like grilled chicken and, you know, just eggs or whatever. But that's really about. And then once I started bloating up like this, my appetite was plummeted. Golly, man.
You may beat the record of what he said. The most
Shoot.
he had ever seen.
But I seriously, I can tell the difference. Holy moly.
Pretty busy out there.
Yeah, we were gonna head out about 5:30. I don't think we left till like 6:15.
Dr. Carla's phone. Who's lactate? Trauma 1's lactate with 6.7. Okay. Thanks.
Not a lot of that bloating's gone down though. There still are some tender muscles in there.
Are we third one? Oh, there's still third one.
That's the third one.
So that's 6-7 pounds. All right.
Jeez. That's insane.
Don't touch the blue.
Well, now it doesn't matter so much as long as it stays clean because it's no longer sterile. I touch other things. As long as we don't push that thing back in, we're not introducing new bacteria. So it needs to come out. It comes out, but you don't want to put your hand further down like that.
Yeah, you're gonna get too close.
I got you.
I will let it go a little bit today. I guess it's going fast.
It's going pretty quick.
I think once I turned over just a bit more.
It was worth the wait for you, sir.
Man, no
Get
kidding.
it done right.
I just wish I would have been able to get here last week and.
Well, you might have not gotten
Well,
me.
I was here, but whole different set of circumstances.
Most ER doctors would not do this in the ER. They would get another doctor and
Oh, really?
time consuming,
Right.
and it would be easy just to send them off to somebody else. And I enjoy doing it because it's so satisfying to actually get some results and relief and all that kind of stuff.
I have to go get another bottle. It's a container.
This is
Grab a
kind of
few.
cool. She threw in some salts into that.
Yes,
What
that's
that
hard.
does, it turns it into a solid,
Oh,
so they can dispose of it properly.
I saw her squeeze something in there, but I wasn't sure what it was.
So it'll turn into a gel. So it's
Oh,
not-
wow.
Oh, I'm gonna.
Slow down there.
That's crazy.
Oh. Man, already look like. At least I
Careful, don't pull
can.
your needle.
There's no way I could do that
No.
before.
No, not at all.
It kind of stopped, so
I'll check up and see if I roll over.
if you do, but
Yeah, careful.
it's coming
Oh,
on.
oh.
It's out. It's out. Let's just pull it.
I'm sorry.
It's alright.
We're already kind of
Oh,
finishing.
there it goes. How's that?
Well, we'll let it go until it stops, and then no more. Because we definitely don't want it going back in.
Right. Alright, don't squeeze anymore.
I'm done. It's like when you go to the bathroom, that's about how long it takes.
Yes, that's for sure.
That is freaking crazy. I mean, it's.
Yeah, look at it turning like green.
Alright. Now we just need a Band-Aid.
These are better. Oh. Whoa.
You Give me a little bit of water on this.
Yes. Just water?
Yeah, just to clean the outside.
Did he rip all your chest hairs off?
Give him a good little tug anyway.
Oh, the sticker.
Oh, I'm sorry, Mike. Oh. Will I be able to eat lunch and stuff this afternoon? You
I think so, yeah.
I was gonna try and eat like a light meal, I don't know. But after not eating really for 2 days, it just, oh.
If you didn't like that sticker, you're not gonna like this one when we're all said and done. I'll help him here. I never put these in.
I think it's off that other way. Oh yeah, your skin's red. Sticker. Okay.
Alright, you can turn that off.
Okay.